Hey, it's Dr. Lenny Roberts here with your Tuesday tip. And today I want to talk to you about something that most people aren't aware of that we can potentially help with, and that's knee pain. And long story short, the reason why I am a chiropractor is from dealing with knee pain. And I've had 6 knee operations, 3 on each side. I had a really nasty injury in high school to my left knee, and then had to have 2 additional surgeries after my first one to try and get that back on track. Junior into senior year of high school, and then my right knee sophomore year of college, had an injury in football, and then had to have 2 additional surgeries after that one from an infection that developed. So long story short, we're getting into some details on that at another time, but I've had 6 knee operations, 3 on each leg. On my left leg, I was told I would need a replacement probably within 10 years of the time of that injury, and that was back in 1991. It's now 2018 and I have not had a knee replacement, and I don't have any plans on having a knee replacement. And a lot of the reason why is because I found out how much other areas of my body had to do with my knee. My foot and ankle mobility, my hip flexor mobility, my nerve flow to my knee. A lot of different factors that come into play that may not be directly from the knee itself. So while I had a knee trauma and a knee injury and needed to have surgery to have that repaired, I was able to build up the musculature and the balance and a lot of proper mobility work that has really aided me a long way. And actually I ran a marathon after having those 6 knee operations. So the path that I thought I was going to be on with a lifetime of chronic pain and not being able to do things and being limited in what I could do, I was able to make some modifications and work on some things. And it did require a lot of work, and it continues to require a lot of work. But I work on my balance, my flexibility, my mobility, work on my posture, and really have come a long way. And right now, knock on wood, my knees are holding up really, really well. And the mechanics of how our foot, so let's use our foot today as an example. The foot and ankle move similar to the wrist, and the motion here similar to how your foot moves up and down. And I had a lot of locking at the base of my foot in what's called the subtalar joint, so it's the ankle joint. And basically this joint was stuck, and I couldn't get the full motion back this way in my motion when I was walking, and that would lead to stress up into the knee. So if this is my foot, think of this as the foot and ankle, and then this is the knee. Similar, very different obviously, but there's some similarities. But this bone was stuck, and it was causing a lot of pressure to continue to build up and a lot of soft tissue irritation around the knee joint. And that's something that we specialize in, working on getting unwound and getting the tissue to glide and move properly. And it's something that doesn't cure every knee issue out there, but it's an approach that often can be beneficial when you work on getting the foot and ankle mobility, the proper support into the foot if you have a dysfunction in your arch, and work on getting the mobility around the knee itself and above the knee in the hip flexor and the nerve flow into the lower back. All those things can be factors in why someone's having knee pain. So that's your tip for today. If you have knee pain, it might not be directly coming from the knee. It could be coming from above, below, opposite side, a lot of potential factors. But some things to keep in mind would be the proper mobility and motion into your foot and ankle and into your hip flexors as well can potentially help you with your knee issues. I'm Dr. Lenny Roberts, and that's your Tuesday tip.